Did you know each year billions of dollars are spent on unnecessary medical tests and medications, all because doctors aren't listening to their patients?
Joining us right now is the author of When Doctors Don't Listen, How to Avoid Misdiagnoses and Unnecessary Tests. Dr. Leana Wen is here. Doctor, welcome.
Thank you for having me here.
How do you know when doctors are not listening to you?
You should assume that your doctor isn't listening to you. We actually know that the doctor will interrupt you in something like 10 seconds after you start talking. So go in and think that your doctor isn't listening.
So you say to actually go in with a script of sorts, map out what you're going to tell the doctor. In what way?
So make a list of all the things that you want to ask your doctor. And I don't just mean the questions that you want to ask, but also a list of your symptoms, the history of why you're there to see the doctor. Otherwise, you have to make those 10 seconds count.
You also talk about when you leave, ask for your diagnosis. I can't tell you how many times you leave the doctor's office or a physical therapist, you go, I don't really know what is wrong. I'm not really sure where I go from here or why I'm taking this medicine.
I have patients coming to see me all the time saying that they got diagnosed with chest pain or abdominal pain, but that's a symptom, not a diagnosis. So you should always ask what you have, how you can get better, and what are the warning signs to watch out for.
I see on the screen, this is the most important question in interviewing on television, but according to you, it's also important to ask your doctor, which is one word, why?
Right. Ask why you need a particular test, why you need a particular treatment. Don't just do it. Know why it's being done and what the risks and the alternatives and the benefits are of everything being done to you.
And if it's why me, that's more of a God question. Keep copies of your medical records. I did not know this. You could actually say, give me the MRI here, find out what their prescription is. You could actually leave with that.
You could leave even with a disc of your CD or of your CT scan or your MRI, but you have to ask. You have to assume that your doctor isn't talking to other doctors that you're seeing, and so you have to take your personal control of your health.
We were talking about this in the break about whether or not our records should be online, our whole medical history. And you think that it's a good idea?
I think it's a good idea for you to have control of your own record. So maybe you bring it with you on a flash disk or something that you can control, but that's good for your health so that all your doctors are on the same page with you.
Mm-hmm. Because, for example, I have no idea when I had my last booster shot, and if you live a bunch of different places, you never find out that information.
Right, and the thing is, Gretchen, if you only brought me to your next appointment, which brings us to the next tip. Never go to the doctor alone. So I got to go to the doctor with Gretchen now, so I can
just cough.
May of 2001. That was the booster shot. So why not? You have to actually bring somebody.
Bring someone with you, because just imagine, even if you have the flu, you're not feeling very well. You can't tell your story, you don't want to ask the doctor all your questions, and so bringing someone with you who's your advocate, your friend, your loved one can actually
Here's my problem, Dr. Wen. I can't get anyone to walk the dog with me, let alone, hey, I'm going to the doctor. Who wants to come?
Find someone today.
I would think your wife would just be so happy you're actually going to the doctor, because men don't go to the doctor, do they?
That's true.
And that's the final point. All right, check out her new book, Dr. Wen. It's When Doctors Don't Listen. Thanks so much.
Thank you.